Mother Knows Death presents External Exams with Nicole Angemi.
Over the past few weeks on Mother Knows Death, Maria and I have talked about a variety of news stories that involve the GI system, and in particular, the newest fad of weight loss with drugs like Ozempic. And on today's external exam, I thought it would be perfect if we spoke with a GI specialist. So I'd like to welcome Dr. Partha Nandi. Hi, it's an honor to have you here.
Well, thanks, Nicole. I like when people say external exam. When my patients say external exam, that only means one thing. So we're not doing that today, but absolutely, it's a pleasure. It's a pleasure to join you today.
Thanks for being here. And Dr. Nandi is a gastroenterologist as well as a holistic health practitioner. And he is a host of his own TV show that is called Ask Dr. Nandi. Tell us about that a little bit. What's up with your TV show?
Yeah, you know what happened was my dad, he was my biggest hero when I was growing up, and he got sick when about how long has it been now? It's been about 16 years ago. He was very healthy, never really had any time he was in the hospital, but he got a devastating stroke. And what happened then, Nicole, is that I thought I was a pretty good doc. I thought I was empathetic. I thought I did a good job. But when I became the patient because of my dad and the advocate, I realized that there's a lot I didn't know. What I mean by that is how to be able to advocate for yourself, what it feels like as a patient through our health system, and also how do I as a patient, not as a doctor, prevent what happened to my dad. So I thought about how to do it. And I had a friend who was a producer in LA, and he talked to me and said, some of the things you talked to me about, Dr. Nandi, we could do a television. So I started a television show that basically talks about empowering, to yourself to be a health hero, which is your own advocate for yourself and your family. And that's what began. And we started one television station in Detroit. That's where I'm from. And then now, we're syndicated throughout the country and the world. It's because we want to have a simple message, is that make your health and wellness your priority, which is a lot what you're doing. So that's kind of that's our mission, our North Star. And then we call the folks that believe in that health heroes. We think everybody should be a health hero.
So when you went to medical school, you specialized in GI. Have you done that since you graduated medical school and did a residency in GI? You've been doing that this whole time?
Yeah. So what happens is you do medical school 4 years and you do residency for 3 years in internal medicine. So you become a specialist in everything, right? Which is internal medicine. And that's helpful for my show because I talk about everything. And so then once you finish internal medicine, then you do 3 more years of being a subspecialist, which is a gastroenterologist. So that means diseases of the intestine, the liver, the pancreas, the colon, digestive issues. So I liked it because you get to talk to people and then be an expert, but you also get to do some procedures where you look inside the stomach. Like today, we had a patient that was bleeding. I was able to put a little clip, stop the bleeding. I think that's cool because you have a patient that's sick, you do something and they get better. That part of it I like. I also like counseling them for prevention. So that's why I like gastroenterology.
I get that. The GI system is probably my favorite system too. I feel like I like it the most when I'm doing an autopsy or something. So I understand why you like it. So how long have you been a GI doctor? For about
decades, couple of decades. Yeah.
Okay. So over the years, you've probably seen, since you deal with the GI system, you've probably seen some changes in weight loss trends, I would say. And I know some of this because I worked in surgical pathology for like 20 years. So I would say maybe 10 years ago, like all the rage was sleeve gastrectomy every day, getting multiple sleeve gastrectomies. And now it seems to be all the rage is like these weight loss drugs like Ozempic, right? And now we have all these celebrities that have been losing weight over the past couple of years. And now over the past couple of months, people like Oprah, Sharon Osbourne, they're all coming out and saying like, yeah, I use Ozempic. So now that's the drug of choice right now. And can you explain to us exactly like what Ozempic is and how does it help a person lose weight?
You're absolutely right. And to me, it's a revolution. It's like it's a revolutionary drug because it's working in a way that people understand it. And when people did gastric surgeries, like the sleeve gastrectomies, like you're talking about, there are multiple ways for people who are listening and watching. Is that how you can have weight loss? One of them is cut out part of the stomach so you can't eat, and you reroute it so you physically are not able to absorb nutrients and not eat. You can't eat enough, and so you physically restrict it. This drug, like you talked about Ozempic and its analog Wegovy. Remember, Ozempic is indicated for diabetes, right? And for people who are diabetics, this analog Wegovy is indicated for weight loss, but people use it interchangeably. So let's talk about just Ozempic. It's a class of medication called semaglutide, and what it does is it kind of mimics it. It pretends like it's a hormone that naturally occurs in the body, and what that does is when that hormone kind of goes up, it goes to your brain, and then the brain says, "Aha, I'm full." So you're not struggling; you just don't feel like eating, which is magnificent for people who are like, "I'm just always hungry and I can't stop it." Right? So it does that. In addition to that, it slows down the digestion by increasing the amount of time it takes for food. So in boxing, it's like a 1-2 punch because you're not only not feeling full or not feeling hungry, but you also feel full for a longer period of time. And that's why it's so effective. Like, a lot of people, and especially my colleagues, are kind of like, they poo-poo it. I think it's not so bad. I think you've tried everything else, and this is the big if, right? I had a lady, Nicole, it said, and she was not obese. She said, Dr. Nandi, can I do it because I want to lose about 10, 15 pounds and look good in my bathing suit? Like, it's not what this is for. That's, to me, the key. You may see Oprah like melting away, or, some other celebrity, and you can tell they like dramatically lost weight. That's one thing, and they're doing it. But if you're not obese, first of all, I don't think you should do that. But secondly, you should couple it with the things we talk about by being your own health hero. We talk about 5 pillars. It's purposeful living. Number 2 is not a diet, but getting the right foods in your body. Number 3 is movement with purpose. You got to move and do things. Have community and spirituality. I think you got to really have a holistic approach to doing this. Let's say you don't do all 5. At least move and at least have healthy foods. It doesn't mean because I'm taking Wegovy or Ozempic that now I can, have a juicy, double cheese, whatever, burger concoction only when I want to eat. So you've got to eat better. You've got to eat healthy and move along with this. But to me, it's going to change things because I've already seen the demands. I do endoscopy, which is basically taking a little scope, going into your mouth, into your esophagus and stomach. I do that preoperatively, meaning that I tell the surgeons, hey, this patient is okay to have a gastric bypass surgery. That demand, Nicole, is way down already. Not to mention what's going to happen in the future as we get more and more of these drugs. So, to me, the gray area is, hey, what's going to happen long term? We're talking about a couple months, 3 months, 4 months, 5 months, maybe even a year. But what happens 5 years down the road? When you've taken this drug. So I'd like to know what the long term side effects are. But I think it's another tool in our armamentarium to be able to fight obesity, which to me is the biggest epidemic in the planet.
I agree with you. And I would say that a majority of the autopsies that I do, the patient has obesity. In younger people that are this prime age of women that I was seeing, especially between like 50 and 60 years old, way too young to die, but all obese. And just, I think it's really important that no matter how you lose it, you lose it because of the comorbidities associated with obesity. But it's funny that you mentioned that about the short-term weight loss for people that, like me, like I'm trying to lose like 5 or 10 pounds. Just take this medication. We had a story in the news actually of a woman that was given Ozempic because she was trying to lose weight for her daughter's wedding to fit into the dress. So we're talking 10, 15 pounds max. And she ended up having a bowel obstruction and dying because of it. And so what are some of the negative effects that you see with this type of drug?
Well, it's slowing down the intestinal motility, the movement of the food, right, that's going through. So people who already have problems with movement through your intestine can cause problems. You mentioned, it's not common. It's rare. You could have problems with obstruction, which is a blockage in the intestine. Let's say if you have a little bit of an narrowing and then you slow things down even more, potentially you can make that worse. You can have problems with gallbladder problems. You can have problems with pancreatitis. There's rare problems with infections. There's all kinds of, other side effects you can have. But the main ones are dealing with your food and your stomach not moving through. So you can have nausea, bloating, abdominal discomfort. So if you have any of those issues, don't forget to mention to your doctor. People are so desperate to get this. They don't want to tell them anything about what's going on. Even if they know that there's possibility of this happening, they don't tell their doctor or their healthcare provider. It's important you let people know this. If you have any gastrointestinal issues, let your doctor figure that out. Any GI issues. So what I mean is, are you nauseous? You have bloating? You have discomfort? Let them know, because this could make it worse. In some cases, it can make it significantly worse, leading to hospitalization. So again, it's not to be taken lightly. It's not just, oh, I inject myself and I'm going to look great. It's more than that. And again, I'll say it has to be coupled with diet and having good food choices and exercise.
Do you think that doctors that are prescribing this are giving that message? Because I personally have friends and family members that take these medications and they still eat like shit. They don't exercise. And one family member, very close one, I won't name her name in particular, had serious issues with motility, like almost had to go to the hospital. And she doesn't have great eating habits and had some kind of an obstruction, severe abdominal pain, ended up passing it, but then had bleeding in the rectum and everything because of it. And I don't think that anyone ever really said to her, you need to change your ways. So that concerns me.
I think a lot of times, we as doctors also want to keep our patients happy. It's easier just to write a script, right? And have them go on their way than taking the time to say, hey, this is what's going to happen. Because then comes so do you think that I should do this or not? Do you see what I'm saying? It's harder to do that. So lots of people say, I think it'll be all right. Say if you take it. Because, well, you've been to people like myself. You don't have a lot of time. I mean, you're in and out so quickly. And if it's just that you're here for the drug that you're looking for weight loss or diabetes management, let's say, then if you just write the prescription, you're on your way. So I think it's our responsibility, and this is for anybody who's a healthcare professional, to really let the patient know this is not a no-brainer. It's like a nothing burden or something. It's not like taking something that is innocuous, right? It's something that's significant in your body that could potentially harm you. So I think that people are not saying, hey, you know what? You could have your kidneys get damaged. Hey, you could have changes in your vision or worsening constipation, or like your pancreas will get inflamed. Because I think that it's just a much more involved conversation. And to be honest, some may not even know that. Some healthcare professionals who are writing it may not even know that there are these complications. So I think it's again, be your own health hero. You're taking something, get to know yourself. We have resources now. Get to know the side effects and see, hey, you know what? I'll go to my doctor and say, I have these problems. And here are the side effects. Do you think it's right for me? It's got to be a joint decision, a partnership. It's not like I want to lose weight, just take this. It's a great drug and it can work. It can work, but I think that I don't think that it's something that should be taken lightly and should be, taken with the direction of your healthcare provider. And you have to ask them, can something bad happen with this?
I like that you mentioned about the long-term side effects, because obviously this drug hasn't been out too long to really know what is going to happen in 15, 20 years down the line with people that have been taking this medication long-term. And obviously this medication isn't for people to take for the rest of their lives. It's supposed to be correct. I mean, if they're not taking it for diabetes management or something. Correct. So, I don't know if you heard this, but recently a huge company, Weight Watchers, has kind of gotten on the Ozempic bandwagon, and now they offer a subscription that you can get Ozempic along with their weight loss program which is good because they teach healthy eating habits and stuff. But do you feel like our culture is kind of like heavily going hard into this Ozempic and giving up things like the regular way that you used to lose weight with like caloric restriction and exercise?
And I think you're absolutely right. To me, you as the person prescribing have to make it very important. Once you get to your goal, you have to continue to do the other things besides the medication. Otherwise, I mean, there's studies right now that show that if you continue to do what you were doing before the Ozempic, you'll gain the weight right back. It's not magical, right? So once you take away the active substance that's making your brain feel like you're full and you're slowing down the speed of the stomach moving food through, you're going to gain the weight back. So it's really important to learn those habits while you're taking the drugs if you don't have those habits. So you're absolutely right. And it's not meant for them to just keep taking it forever. Some people will take it for a longer period of time because they may not get the weight loss, but it's not meant for people who are trying to have weight loss and not having diabetes. It's not forever. But again, we have to let the patients know you've got to be able to understand the other two things that you do, which is movement, which is exercise, and eating well. And to be eating well, that doesn't mean that you eat less. It means that when you eat the foods, make sure they're whole, make sure they're nutritious, make sure that they give you the nutrients you need, and not just looking at the taste and that's it. Like you have a cheeseburger, for example, may taste good, but the nutrient value and the toxin load is huge. So you've got to be able to teach those. We have to be able to do that. Patients who come to you for this have clearly not learned this, most of them, because otherwise they wouldn't be asking you for that. So we have to be able to teach our patients that, to be able to do that. Otherwise, you're not going to be successful. It's going to come again and again, or they're going to be on the drug for a very long time.
Well, now that you're talking about toxic foods, this is a good time to get into this subject. I worked years ago with a brilliant GI pathologist. She was awesome. And she was like very much into the new research of all this leaky gut stuff we were talking about. And back when she was talking about this was like 15 years ago, probably, people were kind of thinking she was a quack for believing in this stuff. And now all of this research is coming out that most people agree that leaky gut is a thing. Could you please explain exactly what that is to our listeners?
Yeah, absolutely. That's a great question. And so if you think about where blood and poop are separated, right? You think that it's a huge barrier. It's one cell layer thick. So let's say this is a cell, my hand. On this side is poop, this side is blood. So your GI tract or intestinal tract, the cells, have a huge job to be able to prevent stuff that's in your poop to go in your blood. And when it doesn't do that well, people who are very insightful, like your GI pathologist that you worked with, called it leaky gut, because this happens. Your gut is leaky, stuff comes through. But now we like you said, there's studies that's showing that this works. So we have a fancier name for it. It's called intestinal permeability. So what happens is that in that one cell layer thick, barrier between poop and blood, you have these things called tight junctions, which are like completely sealed tight. And it's kind of like a very, very sophisticated group of bouncers that will not let anything in or let anything out that doesn't belong. So once those defense mechanisms of your intestinal tract are not there, stuff can get through. And you say, so what? What if stuff gets through? Well, it won't be like big chunks of stool. We're not talking about that. On the microscopic level, you're having little particles, which are toxins, let's say from a bug, from a bacteria. One of them we know is called LPS, or lipopolysaccharide. When that goes in the bloodstream, here's what happens, Nicole. Your entire defense system goes, oh my gosh, something happened. So all of your immune system, so I call it kind of almost your entire defense of your body. So your white cells come in, your natural killer cells, your lymphocytes, everything comes through. If you made the analogy in a country, you'd have the FBI, the CIA, the Army, the Navy, everybody comes and says, there is an attack. Something's come through, and it starts attacking because it thinks something's there. In that reaction, if you have it once in a while, won't matter. But if that leak continues and you have more stuff that comes through, that's the beginning of inflammation, because then these cells continue to be activated, trying to get rid of whatever this toxin that's coming through. And when it continues, it can cause inflammation. And inflammation is the beginning of all disease, whether it's of the heart, whether it's of the brain and lung, any part of it. That's why, to me, the gut, and you and I agree on this, is the gut is such an important part of your body. Why? Because it's the center. It's if you can fix the gut, not get leaky gut, change what's called your microbiome, which is the trillions of bugs in your intestinal system, you can help prevent disease. I'm writing a book about comparing, taking your gut health and optimizing it to prevent diseases of the brain, like the one my dad had. And it's startling what you can do with your gut to be able to prevent that. But to answer your question, this leaky gut is such an important idea, because if you can prevent that and keep your gut healthy, then you can really conquer so many diseases that we suffer with in our country and throughout the world. Stuff like heart disease, cancer, autoimmune disease. All these are inflammatory conditions that can make things worse.
And do you think that this inflammation is obviously, it's like more linked to processed foods, correct?
In a sense, the inflammation is there, but it's inflammation on the side of the cell that's going towards the blood, and also on the side which is in the intestinal cell. And it will be difficult to process food if you have increased inflammation. But what's even more startling is that inflammation can then affect the rest of the body. And this is where it's exploding, Nicole. Every single specialty in medicine, every disease state is finding that if your gut health is bad, then your disease state of that organ is bad. So let's talk about the brain. In Alzheimer's, there's an Alzheimer's gut almost. If you look at heart disease, or people with coronary artery disease, or people with Crohn's disease, or rheumatoid arthritis, there's a change in the way the gut is, and the microbiome as well. In the processing of foods, when you don't have the right environment, your food's processing incorrectly, and your food doesn't become your friend anymore. And that's what we have to prevent. And there's simple ways of doing it. Try not to eat processed foods. It's super simple. Try to eat foods that you can see. Maybe even do the unthinkable. Go into your kitchen and actually use it, and not use your phone to have somebody deliver it, so you can take your rolling chair and go to the door, pick up the food, go back to your couch and eat it. I mean, when you do that, it's so unnatural for human beings. Throughout history, we had to hunt and gather. We had to move around, get our own food, real food. That's what we've been looking at for millions of years, right? All of a sudden, in the last 50 years, you've got everything changed, right? Food's made in the factory and given to you. You heat it up in this thing called the microwave or whatever, and everything's made in a factory. If we can just go back and find foods that your body is used to, like whole vegetables and fruits and things that are meats that are not made in little tiny, coops where artificial growth is happening for meats. I mean, if we eat food the way we used to, then we'll do well. Why? Because that's what's brought us here for all these years. Now, in the last 50 years, everything's changed. So back to your question about the gut and leaky gut, because what the microbiome and the gut does not like is everything that we eat. Let's have a box of cereal, because that's shown on TV, full of processed foods, full of artificial sugars. Or let's have a slice of pepperoni pizza. It's like an atomic weapon against your gut. Bad carbs, bad fat, preservatives. I mean, your gut doesn't even know what to do. It's like, and it's shaking, microscopically. And so you eat that once in a while. I'm not crazy. I have kids. They have birthday parties. Do I have a slice of pizza? Absolutely. But when you make that slice of pizza or your burger or your fries every single day, which a lot of people do, or your TV dinners or your processed foods every day, then your body can't handle it. It goes into overload. Leaky gut happens. You have intestinal permeability, the beginning of disease. And is it a wonder that I have a 35-year-old person with colon cancer, that I'm talking to a 29-year-old saying that, my God, they told me I have breast cancer. Like we're just shocked and bewildered that all this stuff is happening. But the crap that we put in our bodies, and that's just the food we're talking about, not to mention the unbelievable amount of stress that we put on ourselves, right? So all those things lead toward an unhealthy gut. But we can make the simple practices that you do every day that can reverse that. And the quicker you do that, and the younger you are when you do that, the more prolific the changes are.
So you have a guide on your website that people can look at that tells you, it's kind of cool because it's like a quick, if you have to eat processed foods, here's how to make better choices, kind of.
Yeah, and what we wanted people to do is be real, right? So we'll give you a guide and say, hey, you know what, this is toxic, this is not. And so you can look and choose and see what you can do. Because to us, excuse me, to me and the little people that work with me, we want to make it simple. If it's complicated, then it's bad. So this guide is going to be simple. You can read it. It's written in normal language. It's understandable. So yeah, we'll be happy to give it to your listeners and your viewers whenever if they choose to have it.
And you also sell some supplements on your website, and they're mostly vitamins that are they're really good for you, obviously. And with the processed foods and everything, we're not getting a lot of those things, correct?
Yeah, what's happening is that our soil, Nicole, is devoid. We have farmed land. We put so many what are called, GMO products and seeds, basically sucks all the nutrients out of the soil. This is an example. So let's say you eat a cabbage now versus 1935. It's completely different. So what was happening in my medical career is that I would get patients coming with these big old bags and say, doctor, that come with 15 supplements. What should I take? What shouldn't I? Now it said, yes, no, yes, no. And I said, to our team, I said, why don't we create our own line so I can curate it and let people know? We went to manufacturers to see how they actually made it and what their sites look like. And then I wanted to not just say, here is your vitamin D, here's your vitamin K, here's the nutrient supplement that you can take, but rather, is it nutrient dense? So you look at, let's say you go to a grocery store and you have like a vitamin D, it may come in a form that's not bioavailable. What that means is you take it and it seems like the same number as, let's say, the one we picked, but ours is more bioavailable, so more stuff gets in your gut. So we're careful to make sure that the manufacturing is appropriate, that the product is high quality, so that we would take it in our family. So, and I mean, we did that because for many, many years I've been curating it. So we decided to do it on our own. It's from the Healthy Road Pharmacy, and it's just, it's my name, Partha Nandi, MD Supplements. So yeah, if anybody wants to know more about it, I'll give some more information for sure.
Yeah, and that's good because a lot of times, like, I just order my vitamins off Amazon, which is probably a horrible idea because who even knows who's making them. So it's nice to think I could get them from a trusted source. But before we let you go, we want to talk about a couple of news stories that we covered over the past couple of weeks. One, you'll find these really interesting because they're GI related, and they all have to do with foreign bodies, which is always everyone's favorite subject. There was a woman in Spain who said that she was choking on turkey, and she tried to get the turkey out of her throat with a toothbrush, and then she accidentally swallowed the toothbrush, and they had to do an endoscopy to remove the toothbrush. And my first thought, as a person that worked in pathology that's received all of these foreign bodies that you guys take out, I thought, I don't know if that's exactly the story, because I've received so many large things like pens, butter knives from people that were bulimic. And I have heard that the gag reflex is not what it is when people are inducing vomiting so much and they stick larger objects down there to make themselves throw up. And that is what I think how the toothbrush got down there. But again, I think it's possible she was trying to dislodge something, but I think the more likely story is that that's how it got there.
Try to do that. And then, you're right. We see the wildest things people put in there. And I just tell people, just be honest with us. We're not here to judge you. People, you find things in the rectum. They go, oh, I was just I just sat on it, and it's just like, okay, you just have to
That did not happen.
There's no way a gerbil gets inside of you because you sat on it. People put the most amazing things in their rectum and their mouth. So I've seen razor blades, I've seen obviously crosses, I've seen every kind of device that's put in. And then, from the other end, anything that stimulates, the rectum, they'll put in all kinds of vibratory devices, the things that you'd be surprised about. And I just thought, just be honest, we're not here to judge you. And it's the hardest thing is taking those out safely, because people don't understand when you put it in, to take it out without tearing the esophagus, for example, we have to grab it and pull it out so slowly, because you could basically fillet the esophagus coming up, and so the rectum, the sphincter tone is there, and you have to be able to retrieve this without damaging the sphincter tone, something sharp. So it's listen, that's why, we train to do this, but it still amazes me, all the crap that people put in their bodies, and they have very creative stories and how it got there, and the people that come with them to explain. I had somebody whose mistress had tried to do something with him, and got stuck inside the rectum, and the creative stories they come up with is amazing. But it's just human nature, and people will continue to be people.
Yeah, and I imagine it's probably the most embarrassing day of some person's life if they have to go in and say that, and everyone knows how it got up there. That we're not we're not stupid. But just wrapping up, since it's holiday time and we're giving kids presents and stuff, that was another big one that we've been covering in the news, is toys that have been problems. One of them is the water beads. I'm sure you have kids, right? So you probably know about these causing obstructions and the magnets.
Yeah, and I have a 4-year-old, so I have to constantly tell him not to put those things, anything in his mouth. But the thing is that you can't just count on them having common sense as your little kids. So you're exactly right. I think water beads that are going to swell with water, which is in your intestine, can block. If you block the intestine, it's more than a small problem. It could lead to surgery. So we have to tell parents, you gotta be more responsible and keep it out of the reach if you're going to have things that are going to give you problems. Any small object, is important to keep out of the way of kids. And this is not just something to do with the holidays, but a lot of us like those detergent pods. It's one of the most common reasons why kids can have toxic reactions in their esophagus and possibly die, because they swallow it because it's colorful. You ever seen those things that look like, you can be fooled, it looks like candy or something, you put it in your mouth, and can you imagine that? You're putting detergent in your esophagus. It's one of the most horrific things I've seen.
Oh, man.
So I beg parents, if you're going to do it, don't put it in the lower shelf, but as high as possible so kids can't reach them. Give them the fear of God that this is horrible for you. So we've got to really educate our parents, and we as healthcare providers, and you're doing a great job in disseminating this kind of information. People won't think of it, but it just takes one time to make a mistake and your kid's dead.
I know, it's so terrible.
You can't do anything about it. You literally watch this thing just like rip up your esophagus and obliterate it. It's horrific.
Yeah, and then even if they survive, like, what kind of quality of life do you have with all those surgeries that you have to repair it? It's just
can't eat.
I can't imagine going through that as a parent. It must be terrible. Well, thank you so much for your time today. What are you working on, any new projects?
I am,
talk about.
I'm working on my book, and the book is basically talking about healing your gut, fixing your mind. So I'm almost ready to send it over to a publisher. So it'll be coming out very soon. And we're working on a probiotic that'll help us to be able to connect the gut with the mind. So I'll be coming out with that, and they'll be on our website, askdrnandi.com.
Oh, awesome. That's it. That sounds great. I'm actually really looking forward to that. I didn't tell you this when you were talking about it, but I just recently had an experience with that, because I stopped eating gluten like a couple years ago now, because I was having such excruciating migraines and none of the medications they were giving me were working. So I finally just decided to stop eating gluten, and it healed me basically.
Wow.
And for some reason, I decided a couple months ago that I was going to officially get tested to see if I had celiac. So I was going to eat gluten for 2 weeks so I could get my endoscopy done. And not only did I put myself through hell, but my family too. And it's interesting that you're saying that because I had obviously, like, I went down the line of all the things I haven't been able to eat for the past couple of years. Like, okay, I'm going to have a McDonald's hamburger this day and I'm going to have a Dunkin' Donuts this day. I went, and I felt fine. I ate it and I said, "Oh, cool. I'm fine. Like, maybe I could eat gluten again." And then just having it, I only had one serving of it every day, but within a couple days, I was so sick. It was nuts. So I'm back on my gluten-free diet and I'm very happy. But it's a real thing. It's a real thing. Trust me. Like
100%. 100%.
So thanks for being with us today. And that was really great information. And I loved how you talked about the layer between the poop and the blood. It really, it makes a lot of sense. And I hope people get a lot from that. Thank you.
Thanks for having me. I appreciate it. Hopefully we can talk again.
Yes, sure.